expect all kids to have some level of defiance in their daily activities and in their routines, and we actually want that from kids, because that's how they're developing their independence. That's how they're kind of finding where social norms lie, where what is okay, what is acceptable versus what is not acceptable, and they're looking for that boundary, that line of what is okay, what is not okay. And so we want some defiance from children, and we find that to be a very normal process and thing for kids to do. It differs a little bit when we're talking about oppositional defiant disorder, in the sense that the defiance tends to be not redirectable. It tends to be persistent and severe. It tends to be across settings and situations, and it tends to really impact relationships with peers, with parents, within family members, siblings, teachers, and it becomes more of a situation in which there is a lack of kind of respect for that social norm or that social boundary, and that's where there's a difference. It tends to be much more intense and more frequent than just kind of, oh, I bumped against the line, let me draw it back, versus I'm always at the line or just over the line. And so that's when we start to know that there's more problematic or maybe going into that disordered kind of category with defiance. So the interesting thing about ODD, I would say that most people, if you just asked like a common question about when does ODD get like noticed, and people would say adolescence, for surely adolescence. But in reality, really we start to see ODD behaviors in preschool, in early childhood. And that is when we start to notice it. And I think when kids are younger, that we can sort of maybe accept or kind of overlook or justify when they're being defiant or when they're not following in those rules and are creating challenges in their spaces of preschool and maybe at home with their siblings or their parents. We can kind of redirect them just because they're smaller. And we're like, oh, well, it can't be that. But in order to kind of diagnose and get the diagnosis of ODD, those behaviors and those symptoms need to be present in that early childhood and developmental range. And so when we're looking at maybe a teenager and an adolescent coming in for care, we in order to diagnose and to determine, we need to look back and find out if those behaviors were present in early childhood. And most of the time they are, but parents were able to, well, we controlled it by this way or that way, and weren't addressing it in the ways that they need to. But I think when we are looking at diagnosis, we're really looking at the severity and the frequency of these behaviors. And there are a couple of categories that we can kind of go into here that help us to know whether or not a clinician or a mental health professional is going to offer that diagnosis of oppositional defiant disorder. So there is no known cause for ODD. I think that really it is a kind of a combination of things. We don't know exactly what are the main things that will say predictively, okay, if these set of things happen, ODD is evident. But the two big things that are contributing factors are really genetics for kind of how they're going to develop their personality. Their personality characteristics really impact how they're going to respond to emotional challenges, how they're going to respond to boundaries, how they're going to manage anger and frustration. And so if a child has that kind of temperament in which they are maybe hyper emotional and they don't have the ability, or they're hypersensitive, they don't have the ability to just naturally or instinctually be able to regulate their emotions. They tend to maybe have emotions that are more intense than what the situation might call for. If that's kind of already there for them. And then there's the environmental factors. And so there's lots of environmental things that can contribute to this kind of development if that temperament is already there. So it could be parenting style, it could be a lack of structure and consistency in their environment. It really could come down to them just not knowing what those social boundaries are because they don't have that modeling available to them. And so it really is a combination of initial temperament plus environmental factors that play a role in them being able to feel like they know what those social boundaries are and that they can adequately engage in them in healthy ways. I would say that there is no specific, again, because we don't know the known causes. There is no known cause for ODD, but we do know that either an overly harsh parenting style tends, when it's paired with that sort of temperament, can increase risk factors for ODD becoming a potential diagnosis or the symptoms coming to light, or if there's an absent or inconsistent parenting style. So that overly kind of just assuming that the adolescent or the child will know exactly how to parent themselves, essentially. So if there's an absence or an inconsistent parenting style as well. So kind of the two ends of the spectrum, essentially, overly harsh and overly kind of authoritative versus that sort of laissez-faire or absent parenting style. So those are the two that have shown up when in combination with that temperament that can lead to the outcome of symptoms for ODD being more present or more prevalent. So these are big ones because this is also part of what needs to be present in order for us to actually diagnose a mental health provider in order for them to provide this diagnosis. There are some really key factors and symptoms that we're looking for to be present for that diagnosis to be there. And really it is that angry and irritable mood. So in addition to the defiance, in addition to not following kind of social rules, there is that angry, irritable mood, which is can look like losing their temper super quickly, being overly emotional, just easily and frequently annoyed by others, and maybe even intentionally annoying others. And so it can be both, being like irritated by everyone or being actually activating and agitating other people as well. And then being like that angry, resentful, just like consistently across all environments. They don't tend to find pleasure in the things that we would think they'd find the pleasure in. They kind of find that and in normal activities, things that, we would enjoy, they're kind of just angry and grumpy during those things. And then there is that component of being angry and defiant, and that is particularly with people in authority figures. So we see it with parents. That's like the first one that shows up, but then we'll see it with teachers. We might see it with coaches. We might see it with, someone who is, if they're like on their bike or whatever, and there's playground rules, we'll see it in someone who tries to provide a redirection to them in following kind of the playground structure or rules. Or as an adolescent, if they're in a store, and someone's like, hey, we don't do this in here, or can you bring your volume down, or whatever it might be, they're going to instantly have that reaction to become argumentative or push against that authority figure. Then the other thing is, like, they'll know the rules to a situation and setting, but they will actively choose not to follow the rules. Even if they're very capable of following the rule or understanding the rule, they will kind of intentionally just choose to not follow that rule or engage in that. And then it is also this component, once they don't follow the rule, they will have the biggest justification for why they don't have to follow the rule. And they'll often blame others for why they didn't follow the rule or why the rule doesn't apply to them. And so it's really challenging, and we'll see the symptom of them not being able to take accountability for the things that they're choosing to do and the choices that they're making for themselves. And then kind of the final component that we really look for is this being kind of resentful or vindictive. And that can look like saying and doing hurtful things, mean things to people for seemingly no justifiable reason. They'll seek out opportunities to just kind of get a dig in there where they can, and it doesn't seem to make sense to others around them. Like, well, why would you do that? What was the purpose of that? And so it'll be this sort of kind of vindictive, revengeful behaviors that are seemingly out of, the norm, but characteristic to them. This is kind of like, you almost learn to anticipate it from these folks. And so those are the kind of those are the big things. So that angry, irritable mood, the argumentative defiance, and then the vindictive kind of mean behavior, vengeful behavior. And then in kind of that diagnostic setting, again, we'll look at those and see how severe they are, how persistent they are, and if they've kind of been present for at least 6 months, and usually in a variety of situations and settings. And so those are kind of the big characteristics for ODD that really stand out. Oftentimes, these kinds of behaviors are going to impact all of those situations and settings, and this is the component really that often gets these children or these adolescents and people to seek out help, is because it really does show up and impact grades and school performance. It shows up in poor social relationships. Oftentimes, parents of these children will say, well, they can make friends, like they can be charismatic and they can make friends on occasion, but they almost never are able to keep friendships. They often do things that are hurtful to their friends, and their friends end up kind of distancing themselves from these people or these kids. And oftentimes these kids have impulse control, so they're making choices on the daily that are impacting their overall functioning, and they're getting into trouble in a variety of places and spaces. So whether it's going to the store and they don't want to follow like the rules in a store, so they may take something, and then they, that impulse, because the impulse is there, so they take something, and then that impacts their ability to go to the store. It impacts trust. It impacts like their friends being like, well, I don't want to go with you to the store because like I don't know if you're going to take something, and I don't want to be involved in that. And so I think that it really impacts their social kind of circle in a big, huge way. And since they have that impulse control, and they really lack respect in a lot of ways for social norms and social boundaries, they can get themselves into legal trouble. So they don't want to go to school. They don't want to follow the rules in the school. So they get involved with the school's, administrative system. Or if they do have impulse control and they take something from a store, well, then there's potential legal, outcomes to that. And then kind of in addition to this personality style or their temperament, and then if they kind of have these environmental factors that lead to these symptoms becoming present, they are at higher risk as well of developing other mental health challenges. And so whether that's depression or anxiety or substance use or, a variety of different things, even kind of feeling like they don't fit in or they get negative outcomes from their environment frequently, so they could have some suicidal thoughts as well. And so I think that just because they kind of have maybe this tough exterior shell that they present with in settings, they often are feeling pretty dysregulated and upset internally. And so that is a big component and a big thing that does get impacted. So they're not feeling successful in their school environment. They're not feeling successful in their friendships. And so even though they may present as like not caring or tough or mean in those situations, they often can have some real internal challenges as well. So the wonderful thing is that there is treatment available, and that can be really effective for addressing the symptoms of ODD. And it's really a two-pronged approach, I think, to be the most effective with addressing these symptoms and reducing the severity of which they're showing up. And really the first step, which may be counterintuitive to some people working towards treating ODD symptoms, but really the first step is parent skills training and family therapy, because really building skills for the parent and working on building like the parent's ability to regulate themselves so that they don't take personally or kind of internalize what is happening externally with the behaviors of their child. So it is really building skills and learning how to not react emotionally, but react in a way that is going to help set clear and supportive boundaries for the child to respond in a healthy way and build their skills. So it's teaching the parent skills to both regulate themselves in this situation and then offer strategies for their child to emotionally regulate, because that's kind of the starting point, is that temperament and that inability to regulate emotions, which creates the reaction or the response from the client in these ways. And so really the first step is that skill building for parents. And then it is family therapy. And that could be, there's lots of different types of family therapy. So whether it's parent-child interactive therapy or a different style of family therapy, but it's really helping the parent to rebuild that relationship with their child and in letting the child know that their parent sees positives within them, because by the time a family is usually seeking treatment for their child, their relationship has become so tense and the parent is reacting to the behaviors and not to the relationship that they have with their child. So that family therapy and really focusing on addressing the positive things that the child is doing. So oftentimes when we become a parent of a child that has ODD, we're only trying to keep them safe and we're responding to all their negative behaviors, which unfortunately tends to reinforce, because we're spending a lot of energy and we're spending a lot of time on those negative behaviors. And that inadvertently, unintentionally reinforces those negative behaviors and helps them to continue. And so through this skill building and family therapy, the parent gets the opportunity to learn how to spend more time and invest more in the positive things that the client is doing and the child is doing on a regular basis. And they're spending more energy and more effort on those things, therefore reinforcing the things that we want to build within that child and helping them to know know that that's what we're looking for from them. And that's how they're going to get their needs met. And that's where they're going to get their parents' attention and their parents' energy and effort and love and rebuilding that relationship. And so that parent skill building and that family therapy is like the key critical tool to really addressing and building the structure and the environment that the child is going to need in order to reduce the symptoms that we see within ODD. And then, of course, there is a component, right? The second prong of that is really working with the client. So that can be an individual therapy. And oftentimes right now it's kind of CBT, helping the client really configure the way that they're thinking about the world and the way that they interact with it. And so could be, but depending upon the child's age. So if we start early, we might do play therapy, experiential therapy, and talk therapy are all good options for really working with the client and the child on building their understanding of their emotional reactiveness, because that's again where it all starts, is kind of these other feelings and their way genetically of responding to emotions. And then we're going to teach that child also skills to regulate themselves. And so that is usually done. I mean, it can be done in that individual therapy session, but it can also be really effective to use group therapy for that and helping to build those social skills again and practice it out in real life, and in having them learn skills to regulate themselves. So that family component and then that individual component is really the best way to address and to reduce the symptoms of ODD. So I think one of the big things is really, I kind of talked about that as far as parents, setting that intention to focus on the positive things. But this is a situation in which you often can't do this just by yourself. So as a parent, kind of reaching out and working with teachers, working with community members, working with anyone that interacts with the child to help provide positive praise for the things that they're doing well. So getting everyone on board that interacts with the child to provide praise for when they're doing the things that we enjoy about them, when they're engaging in positive behaviors. So getting everyone who interacts with the child on board with doing that. And so really focusing on those positive things. And then modeling. So modeling the behaviors that we want and focusing on that versus focusing on just, of course, when there's safety concerns, we need to address those behaviors and take that. But to take the emotion out of those situations and model all the behaviors that we want to see from the child. And then as a parent and as a teacher, it is picking your battles, right? So these kind of children love to get into power struggles. And so being aware of that and being aware of that characteristic for them and knowing that that is a component of what they're dealing with and a symptom of this. And so choosing to pick your battles, knowing when to get engaged and knowing what is important, which is often comes down to safety. So you're going to battle when it's a safety concern, and all the rest you're going to reduce your engagement in that, and then really try to focus on the positive things. Setting clear boundaries and limits and expectations. So being very clear about that, setting that routine, setting a structure is going to be really helpful for these clients, because they want to be consistent and they're looking for control. And so when things can be clear and limits are set, they can know where they hold control and where they might need to learn to let go of control in some ways. And then I would say, for everyone involved, be prepared to spend time, right? So these are often children that we might not enjoy or not want to spend a lot of time with because of that revengeful kind of mean stuff that can come out as a symptom. And so being diligent and spending time with them, because really they do need that modeling. They do need that time. They do need that energy. And so knowing that it is about leaning in and reaching in and spending time doing things together so that you can repair that relationship and build it back to a point where they want to hang out with you and they care about you and you want to hang out with them, and they can feel the care that is there. And then the final thing I think really is be prepared for it to be challenging. so as you go through this, teachers knowing that there is going to be good moments, and then and parents too, knowing that there's going to be good moments, and all the effort that you're putting in, even if the child struggles to take your effort initially, keep going, because it is that consistency that you can provide that really is going to help them know that they don't have to continue with these strategies, and that they can accept taking change and making change. And so be prepared for it to be challenging is the other one. And I think knowing that ahead of time can be really, really helpful for both parents and teachers and community members, or anyone that is kind of supportive to the child. I can say that medication is often a part of the puzzle, or can be part of the puzzle. Medication is definitely, there are no medications that are the answer or the key or the kind of solution to ODD symptoms, but they definitely can play a role. So if there is some underlying anxiety, or there's underlying depression, or there's underlying ADHD symptoms, or there's a need to just kind of regulate that impulse control. So medication can be a component to the process, and there's a variety of different ones that can be useful depending upon kind of which avenue might be most supportive to the underlying challenges that the child is experiencing. But I think it is really that combination of, the parent skills and the family therapy, and then helping the child develop the skills as well to regulate their emotions. And sometimes medication can be a component that can be useful in aiding them in being able to regulate, so that they can take in the strategies that are being presented in individual therapy and skills training. So. That's a good question. I guess I don't know if I would say that it can technically be outgrown, like that in and of itself maybe isn't the case. But I think that if we can identify the symptoms early on, and we can identify some of those environmental factors that are impacting the development and the ongoing persistence of these symptoms, then we can intervene, and we can help the environmental factors to be mitigated, and we can also help the child learn skills and strategies to help them react and respond to emotional stimuli and their emotional needs in different ways. And so if we can get it early on, I think we have a great prognosis and a great opportunity to make lots of shifts and change. I think as time goes on and we get into adolescence or late childhood or even early adulthood, it doesn't mean that it can't be addressed and supported. It might just be that there's more intense interventions that might need to be applied, because at that point, some of the strategies that they're using are pretty ingrained, and environmental structures need to be adjusted. And so I would say that's like when we might consider a residential program, because then we can address safety and we can keep the adolescents safe, and we can really slow the family's responses down to behavioral issues, and really intensely work on that family therapy component, and address any environmental or family structural kind of things that are contributing to, adding to, or influencing the symptoms of ODD. And we can really intensely work on skill building with the individual child to help build their skills. I would say that I think the APA did a study, and they said that approximately 30% of people who have ODD go on to develop either conduct disorder or some sort of personality disorder. But that means that 70% or more have the potential to have positive outcomes and not continue to persist with these types of behaviors and symptoms. And so I think with intervention, that chance of being part of the 70% increase substantially. And so I think if gone untreated, it can persist, but if treated, I think can be quite successful in reducing the symptoms' impact on functioning. Sometimes when there is that diagnosis of ODD or concern of excessive defiance, there is sort of nothing is going to change this, right? This person argues about everything and they're not open to change. But that is a complete misconception, because there's often a really self-conscious and shame-driven person inside of that shell of kind of tough exterior. And so I think the misconception is that this person doesn't want to change or doesn't have an interest in doing anything differently. But that is a complete misconception. Is if we can have them slow down and really focus on their internal needs, we often can find lots of success. I think that sometimes people will have the misconception that because this person with ODD symptoms is rejecting authority and is argumentative and doesn't like rules, that punishment is the strategy for addressing their needs and setting firm boundaries, restriction, all of that. People think that is kind of the strategy towards just forcing change, really, but it's quite the opposite of that. Really, what these individuals need is clear boundaries, clear limits, and consistency in their treatment, but they really need all the positive that we can provide them. And so it is quite, there's consequences and outcomes to choices and behaviors, of course, and those still maintain there, but it is not punishment. It is not negative reinforcement for those kind of behaviors. It really is focusing on the positives that they're doing and reinforcing all the things that we want them to do versus spending our time and energy and effort on the things that we really don't want them to do. I think another misconception that sometimes comes up and sometimes can create a pause in parents seeking support for their child who's exhibiting these behaviors is that it is bad parenting that led to this behavior or this circumstances. And that's a complete misconception. Again, parenting style and environment can influence the symptoms that are there and the severity of the symptoms, but it is not bad parenting. It can be that combination of circumstances that come together. So those genetic kind of predispositions and the way the brain formed that isn't instinctually helping the child learn how to manage their emotions in healthy ways, and then those environmental factors. And so it is not bad parenting that led to this child's behaviors by any means. And so I think it is a complete misconception and sometimes can be a barrier to families wanting to seek support because they don't want to have it be put back on them for their child's choices and behaviors. And then one more that sometimes comes up or I have kind of heard is that ODD is the result of trauma. And so I again say that, trauma is a part of an environmental factor that could be an influencing factor for this, but just because someone has experienced a traumatic event in their life does not equal or cause someone to begin having these sort of reactions or outward projection of ODD symptoms. And so trauma is not always, in every person's history who has ODD, but it can be a factor, but is definitely not, they are not directly correlated. So. Well, first, I think I just would like to let all parents know that it is challenging. It is a challenge to have a child who is presenting with these symptoms, because they are argumentative. They are sometimes mean on purpose. They work to annoy people. And so first, I'd like to just empathize and say that it is a challenging child to parent. And so that kind of leads into the next factor, which is don't do it alone. As a parent of a child who's demonstrating these symptoms, don't feel like you have to do this alone. It is nearly impossible to do alone. So reach out to teachers, school counselors, mental health professionals, community members, coaches, anyone who has extended family members, anyone who can be there to support you in the process of reinforcing those positive things about the child and the things that they're doing that are right, because it isn't just about the parent doing it. It is going to take everybody in doing it, and in order to provide that consistency that is necessary to really shift these behaviors and these outcomes. And so that is a part. And then I think any additional advice, and I kind of said it before, is really don't take setbacks as failures, right? So I think that parents who have a child who has the symptoms and has the diagnosis of ODD, it really is knowing that there might be a couple days that are awesome, and then that creates anxiety or change for the child. And so they may try those strategies again, and oftentimes things get worse before they get better. And so it really is about maintaining that commitment and acceptance about where the child is in the process, and knowing that setbacks or challenges definitely don't mean there's a lack of progress or a lack of potential for positive outcomes in the long run. So sticking with it so that you can get back to having that joyful relationship with your child, and reducing the severity that the ODD symptoms are likely having on every area of their life. And so I think don't do it alone, and maybe even seek out your own therapy to help you through the process, because it's stressful and can continue to be stressful.